Hello, my friends. I'm so happy you're here today. This is a super quick episode dedicated to parents out there who have been in medical rounds with their child before, and the team walks out and you go, "What just happened?" Or maybe you're the parent who hasn't been able to attend rounds because it's at the exact wrong time when you have to help your other child get ready for school or you have to be at your job. Or have you been the parent where the team walks in and you're not at all ready to converse with them? You haven't used the bathroom yet. You're still in your pajamas. Yeah, that happens all of the time in the hospital. Here's the good news. My name is Katie Taylor. I am a certified child life specialist, and I'm going to give you the 4 key takeaways today that I have seen make the biggest difference for families when it comes to rounds and making it as productive, efficient, and collaborative as possible. The first thing I want to tell you about, and no, this is not sponsored, but it's a new company I want us to all be aware of, and it's called Q Rounds. And I actually met the founder. He is a physician and he's a pediatrician. He also happens to do magic. He's very cool. His name is Dr. Mike. And they have just started implementing Q Rounds at some hospitals. And he started it because he was walking in to get his hair cut one day and he had put his name on the list. And he was told, it's going to be 15 minutes and you're the next in line. And he thought, why isn't rounds this easy for families? So you can go look up Q Rounds, but I had to tell you about it if you haven't heard about it before. This is one of those things that whether you're a parent or a healthcare professional, it's going to make it so much easier. Time and time again, I watched families wait and wait and wait for rounds only to have an emergency happen and the team wasn't able to come. Or vice versa, they were told rounds was going to happen at a specific time, but it happened to start earlier in the day, so they missed their conversation with the care team. I feel like Q Rounds is the answer to this, and so it's good for us to know that there are things out there, innovations that are being created to make this a better experience for the family. The second thing I want to do is give you some layers and some context into what rounds actually is and what it exists for. Rounds are really when the whole care team comes together. So it's the physician or the provider who has been there that night or that day, and they're transitioning to another provider or physician. So this is essentially a handoff. Most of the time, what should happen as a child life specialist, I believe, is something called family-centered rounds. And that's when the rounds actually happen in your room and you're involved in the process if you're there and you're present. They can also happen outside of a room. So I've been in institutions where rounds actually happened around a table in a conference room and no families were there. And that has some benefits to it too, because we can have really candid conversations, really understand what's going on, but we really miss the mark in getting parent collaboration and getting family collaboration and having all eyes on the patient. Additionally, there's usually a specific amount of time that all of the rounds on all of the beds need to happen in. And then the provider who's getting off that day still has more things to finish before they have to go. So they often have an incentive to have this go as fast as possible so that they can get their work done and they can be done with their shift. Vice versa, the provider who's coming in wants rounds to be done as efficiently as possible. So they understand, but they also have already so many things on their plate. So everybody has an incentive for these to get done quickly and efficiently. I really think that having an awareness or understanding about how rounds works will help parents in the long run. Is this something I need to attend today? I talked with the overnight physician. He told me what he or she is going to say at rounds. Really think about how the process works and whether or not it's appropriate for you to be there. Whenever it's possible that you can be there, that's amazing. But we also know in healthcare that you have personal lives as a parent. You may have other children, you have a job, you have a dog, you have other responsibilities. And so if you can't be present at rounds, it's really good to talk with the physician who's getting off that night, or perhaps talking to the physician who's going to be there later in the day and saying, can I follow up with you and we can understand the plan together, is really, really helpful. The other thing I really want you to understand about rounds is that it's really hit or miss whether or not your child's nurse will be present during the rounds. We have to remember they often have 3 to 4 other patients they're taking care of. And if a med needs to be given at the time that rounds is happening, they may or may not be able to be there and be present with you. And so as the parent, you totally understand this, right? When your child needs a med, you want it to be given on time. But because the nurse may or may not always be there, it's really good to have a before conversation with your nurse when the rounds team comes in so that you two are on the same page. You've talked about what you are most concerned about. The nurse has a few things that she wants to understand with rounds, or he wants to understand with rounds. And so it's just kind of like a little team meeting before the big team comes in. And that way, if your nurse can be there, she can help advocate for you. She can help ask the questions that you want to have asked. Having that kind of pre-rounds game time is really, really important. The last tip I'm going to give you, tip number 4, is that the minute gut feelings, like tiny things that are in the back of your head, really, really matter. And so I want you to write them down. During the day, you can write them down on a sheet of paper, on the app on your phone. I want you to download Support Spot. That's our app where we have symptom checking and questions to ask the doctor and procedure preparations. I want you to have something where you write down your questions and your instincts and your insights for the day so that those little things that you think or come up in your head are written down. Because I tell you, once the team comes in, they have a job they want to get done, and it can be really hard to try to interject or even remember what you wanted to bring up. So whether it's a question that's been bugging you, or you've noticed that every time your child has this particular medication, they're acting this particular way and you have forgotten it to bring it up. Bringing it up during rounds is a really good idea because there's so many different smart, incredible, intelligent brains in the room, and you can all work collaboratively together. So no matter how small that instinct is, write it down and bring it up in front of the team. That's going to help you make the most of your rounds experience. Let's circle all this back to say that you are never going to be able to be present for rounds. It's just the timing doesn't work. You have work in the morning. You literally cannot be there. That is absolutely okay. And the healthcare team understands that you have other responsibilities. You can ask to be called during rounds and to be on speakerphone. You can ask for your nurse to be present and write down what happens. There are ways that you can collaborate without having to be actually physically present there. As a child life specialist, I have stood in rounds before when the parent hasn't been there, and I've been able to take notes for them so I can tell them what happens or leave it in the room if I'm not going to see them that day. But there are people like the social worker, the chaplain, the child life specialist who could be there to help support and advocate for you and your child as much as possible, even if you can't be there. I hope that this was helpful today. I would love your feedback on other tips that I don't even know or haven't thought of yet, but have worked for you and your family. Thanks so much, and I'll see you next week. As a parent, you want to be there for your child, especially when it comes to their health. But healthcare can be overwhelming and confusing. The good news is child life specialists are experts who help families navigate these challenges. But often our support is only in hospitals. So imagine if you had access to these valuable tools and resources all the time. You would be able to understand medical procedures, explain them to your child, and help them feel less anxious, which also makes you probably feel less anxious. So when your child visits the doctor, has surgery, or has a medical procedure, having the right information and support can make all the difference. You, the parent, can be prepared to answer their questions, calm their fears, and advocate for their needs. Child Life Specialist tools are ready to be in your hands right now through our app Support Spot. All you have to do is go to the iOS or Android store, type in Support Spot. We are giving all of our listeners on this podcast access to the app for just $19.99 for an entire year. You are going to have, I'm not kidding, 7 years worth of resources and support and information that we have been building at Child Life on Call at your fingertips. With these tools in your pocket, you can transform the way your family experiences medical care. Parents, you deserve to be informed and feel confident in your child's healthcare journey. And by having access to Support Spot, you can ensure that your child feels supported and understood no matter what medical challenges come your way. Head to the link in the show notes or go to your app store, type in Support Spot to download it today. Thank you all so much for listening to Child Life on Call. If you head to our website, childlifeoncall.com, you're going to find all sorts of stuff there for parents, professionals, healthcare providers, child life specialists, no matter who you are. Actually, when you just go to our homepage, it'll help you direct to exactly where you need to go. On that, you'll find opportunities and PDUs for child life specialists, parents. We've got a starter kit for you, and clinicians. We even have a clinician course, which teaches you how to be a confident and capable caregiver in pediatrics. We're so grateful that you're here. Please DM us on Instagram. And like I mentioned, when you rate and review this podcast, it helps other families be able to find us. So let's keep doing that. And I will see you again here next week.